Hello everyone, welcome back to Dr. Anna's Physio. Today I'll go through a few terms in the circulatory system. First being the cardiac cycle, what I spoke about in the last class. So cardiac cycle refers to all the events, that is both electrical and mechanical events that take place from one heartbeat to the next. The normal duration of one cardiac cycle is 0.8 seconds. Which includes atrial systole, atrial diastole, ventricular systole and ventricular diastole, and the normal duration is 0.8 seconds. Now coming to the next term, stroke volume. Stroke volume is the amount of blood ejected from each ventricle per beat, per heartbeat. Okay, so that means the amount of blood ejected from the right ventricle and the left ventricle per beat, which is about 70 ml. 70 milliliters. And next is cardiac output. Cardiac output is the amount of blood ejected from each ventricle per minute. So stroke volume is per beat and cardiac output is per minute, and the normal heart rate range is between 60 to 100, the average being 72 per minute. So 70 is the stroke volume, that is the amount of blood ejected per heartbeat multiplied by number of heartbeats per minute. The normal range of normal cardiac output is 5 to 6 liters per minute. Now coming to the end diastolic volume. End diastolic volume is, it's there in the term, the amount of blood in each ventricle at the end of the diastole. So the amount of blood that is present in the ventricle at the end of diastole. So the average about the normal end diastolic volume is about 130 ml. The preload is similar to end diastolic volume. That is, it is based on the Frank-Starling's law, which states within physiological limits, the amount of the more the heart gets stretched, more would be the force of contraction. So if your preload or end diastolic volume is more, the force of contraction within physiological limits, the more the fiber is stretched, more would be the force of contraction. Okay, so that is the initial length of the muscle fiber is directly proportional to the force of contraction. So more my ventricle is stretched, more would it forcefully contract, but within physiological limits. Just like you stretch a rubber band, you release it, the more it contracts. But if you overstretch it, it breaks. Okay, so preload is similar to end diastolic volume. Okay, the amount of blood. So if there is more blood in the ventricle, more would be the force of contraction. So if more is the force of contraction, more is the blood in the ventricle, more would be the cardiac output, right? If there is more preload, there would be more cardiac output. So if the preload is high, the cardiac output increases because more blood would be ejected out. Then we have afterload. Afterload is in simple terms, it is the resistance against which the ventricle muscle has to contract or push the blood. So like for example, the left ventricle has to push the blood into the aorta. So the resistance against which it has to push. So there are two factors. It's called the peripheral resistance, the resistance in the aorta. Now not just the aorta, wherever it has to be pushed. So if the blood vessel is constricted, okay, vasoconstriction means the heart has to pump harder, right? So the afterload would be high. Similarly, if there is vasodilation, the resistance would be less. Blood can flow quickly, so the afterload would be less. Similarly, if the blood is viscous, high viscosity such as polycythemia, against the resistance against which the heart has to push is going to be more. So the afterload is going to be more. Thinner or less viscous means afterload is going to be less. So if the resistance, since afterload is the resistance against which blood has to push or pump the blood into from the ventricle, unlike preload, if your preload increased, your cardiac output increased. It was directly proportional. But afterload is inversely. If the resistance is more or the afterload is more, your cardiac output is going to be less. Okay? And afterload depends on two factors: peripheral resistance, which depends on the blood vessel diameter. If the blood vessel is narrow, the resistance is going to be more. If the blood vessel is dilated, the resistance is going to be less. And also it depends on the viscosity. If the viscosity is more, the resistance is going to be more. Now lastly, coming to ejection fraction. Ejection fraction is stroke volume by end diastolic volume multiplied by 100, meaning the percentage of end diastolic volume that is ejected out, that comes out of the ventricle. That is, at the end of diastole, we had 130 ml in the ventricle, but how much blood is coming out? How much is the stroke volume per beat? Only 70 ml, right? So only 70 ml of 130 ml comes out of the ventricles during each beat. So this is going to be approximately 65%. So ejection fraction, the value is going to be 65%. So ejection fraction of 65% means good myocardial function. So this is usually measured during echocardiogram. That's all for today. Thank you.